Good evening. I'm NET News Director Dennis Kellogg. Thanks for joining us on this special edition of Speaking of Nebraska. Governor Pete Ricketts is here once again to answer your questions during tonight's town hall discussion, as well as Director of Economic Development Tony Goins and Dr. James Lawler, Associate Professor of the University of Nebraska Medical Center, who has focused on infectious diseases. Now, you can join the conversation tonight by calling us at 800-676-5446 or 402-472-1212. You can also email your question to us at news@netnebraska.org. Governor, let's start with the situation as it stands right now in the state regarding coronavirus. 10 more counties have confirmed cases of COVID-19, and as of this evening, there are nearly 580 cases across the state and 15 deaths. Now, you issued a new proclamation today called 21 Days to Stay Home or Stay Healthy,
and
emphasizing...
stay healthy.
What's that?
Stay home and stay healthy.
And not either or.
Not either or, it's both.
That's a very important point there. But you're emphasizing these next 3 weeks are the critical weeks. So does that mean if we do, as Nebraskans, what we're supposed to do, we stay home, we social distance, we do all of the recommendations, that 3 weeks from now we may see a loosening of some of the restrictions?
Well, what it means is that the next 3 weeks are when we expect to hit kind of our peak here in Nebraska, based upon some of the models that are out there. And so this is really the time for Nebraskans to really redouble their efforts on social distancing, and that's what the proclamation is about, those 21 days to stay home and stay healthy. So it's really about all the things we've been talking about, but just really doubling down on them to be able to knock down this virus over the next 3 weeks and to really make sure that we're well positioned in May to start looking at, can we loosen some of these restrictions that we've got in place. You know, when we loosen them, we're going to do it over a period of time. We're not going to do it all at once, and we're going to do it gradually to make sure the virus doesn't come back. But here's really the time we've got for the next 3 weeks, and so we're asking Nebraskans to really step up. You know, it's a personal responsibility for everybody. It's a civic duty to be able to help stop the spread of the virus here in our state. Every Nebraskan can be a part of that. We published 6 rules to be able to do that, which starts with stay at home, don't take non-essential trips, make sure that you're not going out to socialize. Really want you to, go out and do the essential things like shop, but don't do anything else. Stay home. Second, work. And when you go to work, try to work from home. All right? We want you to work from home. But if you have to go to work, keep social distancing, that 6-foot thing. The third rule is shop. But when you shop, send one member of the family out. Only do it for, one trip. Be efficient. Have a list. Don't take the family with you. One person goes once a week. The third is help kids social distance. No play groups, no team sports. Keep the kids at home, no playing on the playground. Keep them around the house for the next 3 weeks, or when you take them outside, don't do it in big groups of kids. We're really trying to prevent the spread of the virus, and that's one of the ways it happens with kids. The fourth is help seniors. People who maybe need shopping done for them or errands, but don't go visit them in the long-term care facility because we don't want to create a problem there. And then we get past that kind of stuff, and then we want to really start thinking about, okay, what else can we do to really, crack down on what we're doing here? And that means, continue to follow all the other social distancing guidelines that we got going on. We want people to really focus on this as we go into these last 3 weeks to knock down the virus.
Dr. Lawler, last week you used a baseball analogy. You said we're in the second inning of this game. What inning are we in this week, and how long is this going to take to play out?
Well, maybe we're in the bottom of the second now, but we're still pretty early on in this entire event. The reality is, with a population that has no immunity to the virus, we really don't return to normal, and we're not rid of this event, of this pandemic, until we have a vaccine. And so that timeline still looks to be maybe a year or a year and a half away. Normally it takes 7 to 10 years to develop a new vaccine. So this would be really a record timeline to get a vaccine by a year to 18 months. But we're not going to be able to lift every single social distancing measure. We're not going to have life as we knew it until we have a vaccine and we can protect people.
Director Goins, I want to ask you as well. New unemployment numbers are out today, and they show another big increase in the state. We're seeing last week more than 26,000 Nebraskans filed first-time jobless claims. That's up 8% from the week before that. Looking back on the last 3 weeks, more than 66,000 Nebraskans have filed for unemployment benefits. So businesses and employees have both been devastated by the coronavirus in a very short time. Do you think we're ever going to get back to the economic stability that we saw just a couple of months ago?
Well, Dennis, let me say this. I think that Nebraskans are tough. We have a lot of grit. For me, I always fall back on the Stockdale paradox, and that is embracing our current reality while maintaining a high level of optimism. I think there's going to be a new norm, and I think that new norm will be really looking at the business model. So to answer your question, I think that gradually we'll get back to where we were, but it's not going to happen overnight. Even once this virus passes, there's going to be a ramp-up period, and people are still going to somewhat be hesitant about going out and being in large crowds. But I do think at some point we'll get back to certain levels. I think there'll be a lot of pent-up demand, and certain businesses will be able to thrive after this virus passes.
So this is a long blip on the radar screen, but we're going to get past it.
We'll get past it.
Yeah.
I believe that.
Well, hundreds of Nebraskans have already sent in questions for tonight's town hall meeting. One question we continue to get every day is why Nebraska is one of just a handful of states without a stay-at-home or a shelter-in-place order. A lot of viewers wanted to know what federal health officials think about Nebraska's response to the pandemic. Dr. Anthony Fauci is one of the nation's top health experts on the coronavirus pandemic. He recently had a phone conversation with Governor Ricketts and Governor Reynolds of Iowa, and afterwards commented during a White House briefing Monday about the approach being taken in those two states.
I had good conversations with the governor of Nebraska and the governor of Iowa here, and it's interesting that functionally, even though they have not given a strict stay-at-home, what they are doing is really functionally equivalent to that. And we had a really good conversation with both of the governors. When I had mentioned that, I think there was a public response that they weren't really doing anything at all, and they really are doing a very good job, both of them. Those are the only two that I spoke to, but it was a really good conversation, and I want to make sure people understand that just because they don't have a very strict stay-at-home order, they have in place a lot of things that are totally compatible with what everyone else is doing.
If I can ask a question.
So very positive comments from Dr. Fauci. Governor Ricketts, did he have any concerns at all in your phone conversations with him about what we're doing in Nebraska?
No, he actually really didn't. In fact, at the end of the conversation, he said, hey, we're all on the same page and you can go tell people that. So it was a good conversation because we got a chance, both Governor Reynolds and I, to really talk about the steps we're taking. And and I think we talked about this actually on the last program as well, that if you look at what we're doing in Nebraska and Iowa, some of the things we're doing are actually more restrictive in states like Ohio or Florida in certain cases. So last week you talked about Florida and the religious services. In Ohio, for example, they don't have any limitations on people going to weddings or funerals, where we do, because again, those are large crowds, so we've restricted those. So I think getting back to what Dr. Fauci was saying was, again, functionally we are doing that. And of course, that's what we're all about with today's announcement, the 21 days to stay home and stay healthy, our 6 rules. I mean, everything was about focus on stay home these next 21 days. Don't do anything that's not essential. Really focus on, that daily exercise in a way that's socially, properly distanced. Don't go out and do those errands that don't need to be done. It's really about focusing the next 3 weeks on stay home and stay healthy. And of course, at the beginning of the week, we put that together with stay connected, because we want people to remember to look out for people in their communities like, our seniors or people who, might be in danger of being abused or something like that. We want, for example, a lot of our calls into the hotline for child abuse from teachers. Well, teachers aren't out there right now watching kids in classrooms, so we need everybody else to kind of keep an eye on those kids who may be at risk, because we don't have the ability to have our teachers do that. So that's part of that stay connected thing as well. So stay home, stay healthy, stay connected.
So as you mentioned, you said that Nebraska's measures are in some ways more stricter than some of the states that have those stay-at-home measures. We had a question from a viewer in Omaha who's wondering if Nebraska's directed health measures are actually more strict than what states have with stay-at-home orders, and why not just give the stay-at-home order, be very clear about it? What's the downside of giving that order?
Well, I think what we're really talking about is we have to have voluntary compliance. We don't have enough cops that we can put on everybody's doorstep and make sure that they're doing staying home and so forth. We need people to voluntarily do this because they understand how important it is to protect those vulnerable people in our society. And in this case, it's going to be older Nebraskans with those underlying health care conditions. So we need people to do this voluntarily. And that's the thing about Nebraskans. If you ask them to do the right thing, they'll step up and do the right thing. And that's what we're doing. We're asking Nebraskans to, exercise their civic duty, to take that personal responsibility, exercise the freedom that they have to do the right thing here. That's why we outlined the rules. That's the kind of thing that I think Nebraskans will respond to, and that's what Nebraskans have been responding to.
So another question for you, Governor. Dave from York says, with the new directive, are drive-up church services with windows rolled up and no interaction still okay? Of course, many people celebrating and observing Easter and Passover at this point. What's your advice?
Yeah, so first of all, when it comes to celebrating the holiday, we really encourage people just to celebrate with the people in your household. So again, part of that whole social distancing, avoiding groups of 10 people or more than 10 people. But when it comes to drive-up services like that, yeah, those are absolutely okay as long as you're not passing anything between the cars, no songbooks, no passing the plate, no communion, nothing like that. If people are just driving up in their cars and staying in their cars, then that is absolutely fine, because what it's really doing is getting away from that idea that you're mixing people in big groups. That's one of the things that spreads viruses. This is why we've asked schools to operate without kids in them, because that's the highest concentration of people we have in our society, is those schools where all those kids are. And as you know, kids aren't particularly health conscious, so we try to avoid those big crowds. But if you're in your car with just your family, that should be all fine.
Dr. Lawler, you were one of the people that Governor Ricketts has listened to when the two of you developed that plan together, or maybe more than just two of you. How do you feel that the plan that you developed in early March has been executed, and are you willing to make changes to that plan as we move forward?
So I think that we need to reassess on a daily basis what the data tell us and how our current levels of community mitigation efforts are performing. That plan, to be fair, wasn't necessarily my plan or our plan. That was a plan that really had been developed.
James, you can take credit for it. It's fine. Whoever developed that plan isn't around. It's fine.
This was research and modeling and a great deal of effort that went into developing plans in the mid-2000s for pandemic influenza response. And this was a national effort that was launched by the White House in 2005 and 6. And so a lot of the best infectious disease modelers in the world looked at how to mitigate an influenza pandemic, looking at these types of community mitigation efforts. Now, this isn't influenza, right? It's a different virus, so we have to take into account some of those differences. But from a transmission perspective, how it propagates in the community, there are many similarities. And so at least the fundamentals of that plan, we applied to what our actions were here. From what we've seen so far in terms of the numbers that we see, clearly what we did had an effect, but as I've told the governor, the numbers that we can't see sometimes are the ones that I'm concerned about. We don't have enough testing to really have great visibility into community disease transmission, and we need to work on improving that, and we need to adjust our actions based on what we find.
We saw some of those models this week, and the number of projected deaths dropped. And is UNMC working on its own model? Are we going to see that anytime soon?
Everybody has a model. And so models are helpful in terms of being directional. They tell you somewhat the direction that things are going. They help you to look at the consequences of actions. But they really need to be taken in aggregate and together. Every model is just a tool. There's an old saying, I feel like I should have this tattooed on me now. All models are wrong, but some are useful. And so that's how we should look at them. I would not look at one model, even IHME, which is one of the best modeling and data shops for public health in the country. I would look at all of those in total. And in some ways, it's like tracking the hurricane. If you look on the Weather Channel, they have those maps that have about 100 different strings going in different directions. Those are all the different models, and some of them are very disparate. But in average, you see that red cone of probability of where the eye is probably going, and that's what we're looking at. We have an idea of where this is probably going in the community based on what we've done. But there are those outliers out there, and you need to keep your eye on the data every day to make sure you're following on the track you think you are.
Economic Development Director Tony Goins, a question for you from Sarah in Sydney. The state of Nebraska was already losing considerable businesses before the pandemic with the loss of Cabela's, TD Ameritrade, ConAgra, and now Hayneedle. How are you ensuring that large organizations stay in Nebraska through and after this crisis?
Well, what I can say is that we continue to make contact with all of the companies that we had in our pipeline. We're continuing to work with some of the firms that are here, and we're giving them advice on staying engaged with their employee base. I mean, at the end of the day, talent is at a premium, and those companies that stay engaged and continue to communicate with their talent and communicate with their customers will survive and thrive after we go through this tough period. So to answer your question, economic development has not stopped. I mean, we are continuing to recruit jobs. It's in a much different form now because we're not traveling, but we do have Zoom. We have conference calls on a daily basis. We look at our pipeline, and we are continuing to articulate the value proposition of doing business in the state of Nebraska.
Well, what kind of reaction do you get when you knock on the door of a large company and say, come to Nebraska, especially during this time?
Well, we're not sending a message to say, come to Nebraska right now. We've already had customers or companies that we've been in discussion with. That's what I mean when I talk about our pipeline. And so we're continuing to make sure that we have conversations with those companies that are in our pipeline, and we're letting them know when this passes, we're still open for business.
And I think the other thing too is you're engaged with other companies, current companies here in Nebraska as well,
We are.
right? I mean, I know I've been talking to people like Fiserv and Union Pacific, and I was just on the phone for a different reason talking to a lot of the companies in Grand Island. But I think that ongoing communication with companies is part of really explaining what we're seeing, what we're doing, and encouraging them that, we're going to be there for them.
Absolutely.
Let's keep talking about the economy. We have a video question now for Governor Ricketts. Concerns about the economy on everyone's minds right now. Andy in Atkinson sent us this question about an issue he says their whole community is concerned about.
Hello, Governor Ricketts. I'm Andy Hoffman from Atkinson, Nebraska. Nebraska farmers and ranchers are suffering from poor corn and cattle markets. Many are still flooded out, and now coronavirus is impacting their homes like everyone else's. And now, in the midst of all of this, on May 1st, the first half of property taxes are due to be paid. Will you, as governor, work with the legislature and county boards to assist with emergency property tax relief, such as perhaps a 12-month waiver of the 14% interest that late payments accrue?
Governor?
So with regard to the May 1st payments on real property taxes, just like the April 1st dates, those are all going forward. And it's important to remember that those are important. Like, the state doesn't collect any property taxes. I mean, that's the first thing. That's not our revenue. That all goes to local entities, and they rely upon that to be able to do the important services that they do. So I think that's one of the things. Obviously, I've been working on property tax relief with the legislature every year I've been governor, and we've made a number of steps to be able to provide relief through things like the Property Tax Credit Relief Fund. And when the legislature's back in session, I'm sure there will be a lot of discussions about what we do with regard to those property taxes and so forth. I have signed an executive order that would waive some of the penalties on personal property tax filings. I don't want to get too into the weeds on the esoteric part of it, but there's filings due on personal property taxes that largely impact farmers, and I've waived the penalties on those for the next couple of months with regard to those filings. So we are looking to do things we can do, through executive order or through administration, but to do something that is going to be, large scale with regard to property tax relief, such as Andy's talking about, is really going to require the legislature to come back in, and because as a governor, I can waive statutes, but I can't create new statutes. And that's where we need the legislature to come back. And then, that's certainly not going to be probably for at least another 5 weeks. So I don't want to hold out, too much interest that something's going to happen here before May 1st. It's probably going to happen if, the legislature comes back the second half of May, but that's really not even my call. That's up to Jim Scheer, the Speaker of the Legislature, when he wants to bring his members back.
What about the economy and the budget? I mean, we know that those revenue projections are going to be way down. How is that going to affect the budget before the legislature that eventually gets to you?
Yeah, certainly we know there's going to be impacts on the budget. For example, when the federal government moved the tax filing date from April 15th to July 15th, if everybody took advantage of that, that would move about $385 million from this fiscal year to next fiscal year. And of course, what we're asking is for folks to if you haven't been impacted by the coronavirus, please still file by April 15th. If you have absolutely, if you've been impacted, if you're one of those folks who's lost their job or their business is closed right now, file, later. But if you're one of those people who hasn't been impacted by the coronavirus, please file by April 15th. I'm going to be filing by April 15th just because moving that much money out from one fiscal year to the next year is going to create some challenges for us to manage that within our budget. And as we get new financial projections, we will have to work to manage that within the budget. The one thing I would say is that we are in a very strong financial position here in the state of Nebraska. Compared to other states especially, we've got a strong cash reserve. We'll be able to manage through this, at least in the near term. And we're going to have to see how this all plays out, how long it lasts and so forth. But it is definitely going to be a challenge for us when it comes to the budget and when that comes back in, and we'll have to see what all is going to be possible.
Dr. Lawler, I want to ask you a question from Sally in North Platte, kind of a complex medical question, so I'll summarize here a little bit, but she's seen posts from several doctors saying we're treating COVID-19 wrong. It's not a pneumonia or an ARDS, but rather a prolonged and progressive hypoxia, which starves the body of oxygen. Ventilators are not the answer, can cause further damage. We need to be treating with high levels of oxygen and also specific drugs. Is that a legitimate approach, a legitimate thing that people should be considering when treating?
Well, certainly we're treating these patients with high levels of oxygen, and some of these patients are on 100% oxygen. So it is a complex disease, but ultimately it is a pneumonia where you have inflammation of the lung tissue, and that creates problems where oxygen can't get from the air inside the lungs to the blood vessels that carry it to the rest of the body. So the primary problem is in the lung, and oxygen is an important treatment. Sometimes oxygen is not enough. The lungs lose compliance. They're not as stretchy and flexible as they normally are when they get sick. And so a ventilator can actually help to mediate some of those problems to get proper aeration into the lungs so you can actually get the best gas exchange.
What about some of the drugs that we're hearing about? What's your opinion on some of those?
So I think that it's really important to look at these drugs objectively and not to get carried away in using drugs that may be harmful. And my colleague, Dr. Andre Khalil at UNMC, has written a couple of important editorial pieces. There was just a piece in the New York Times that talked about this. And I think what people fail to realize when we fixate on these drugs that may have benefit is all drugs have side effects as well. All drugs are poisons, what my professor in my pharmacology class used to tell us in medical school. And it's true. And all of these drugs that people have been touting as potential therapies for coronavirus, hydroxychloroquine, azithromycin, have significant side effects. They have profound impacts on cardiac conduction. They can predispose people to arrhythmias, especially older people who are on other cardiotoxic medications. And so these drugs can harm people if they're not used well. And the way to understand whether these drugs help people and they don't harm people is to use them in the context of a clinical trial. So we can get the data, we can understand how well they work, we can understand whether they're safe or not, and then we can understand how to use them effectively. Otherwise, if we use them really outside of that context where they have not been well tested for this disease, we really run the risk of harming people. And unfortunately, we've had that experience over and over again, and hopefully that's one we'll learn from.
And are there active clinical trials going on right now in the United States and around the world?
Absolutely. We have a clinical trial that's ongoing at our hospital testing one experimental drug in a randomized controlled trial. So we don't know whether our patients are getting the drug or placebo, which means we can't bias the outcome of the study by treating them differently. So we'll know at the end of this study, and it's in collaboration with a number of other medical centers around the world. We'll know at the end of this study, which is coming up very soon, whether this drug was helpful, whether patients had a survival advantage, or whether they didn't. We had this experience in Ebola again, where a lot of the drugs that people were very enthusiastic about using and giving to many patients because they thought, what do they have to lose? Well, actually, these drugs turned out to be harmful. And so there is a lot to lose when you take that approach. And we really need to use these in the context of a clinical trial. The hydroxychloroquine has several clinical trials ongoing right now, and we should know more about how well that drug works once those trials are finished.
Okay, Governor, a question from Mayor Stan Klaus from Kearney, who is asking if the governor will consider saying physical distancing instead of social distancing to impress on people how important it is not to gather or socialize.
Well, first of all, Mayor Klaus has my cell phone number, so he should just call me directly. Second of all, if you've been watching all my press conferences, I have said physical distancing in some of those things. So, but that's a great point that the mayor brings up, that sometimes when we say social distancing, maybe people don't understand what that means, or they think about social media, and so it has maybe a different context, maybe especially for younger people. So, you know, he's absolutely right. What we do want to talk about when we say social distancing, we really mean that physical distance, that 6 foot between people. Again, you notice that we're very spread out here in the studio just for that reason. So the mayor is absolutely right, and thank you, Mayor, for calling and letting us know about it, because that is a great way to highlight for people what we actually mean with regard to physical distancing and social distancing and how they're really the same thing.
John from Kimball County says, will people who are behind on taxes or whose taxes are under dispute still be receiving the stimulus checks?
So the question from John about stimulus checks, I don't believe that the two are tied in any way, shape, or form, especially if you're talking about, you know, the state of Nebraska with regard to what we're doing. The federal government hasn't said anything to us about, gee, give us a list of people who aren't paying their taxes because we're not going to send them checks. I think that they're just trying to get money into the hands of people so they can buy groceries. I don't think the government's worried about right now if you can pay your taxes. And I got to tell you, I think that's the attitude of a lot of people. That, you know, what we've said is, hey, if you're a tenant, go to your landlord and see if they can do something on your rent. I know there's Lincoln landlords who've cut people's rent here in Lincoln in half. If you're a landlord, go to your bank. Ask them what you can do about the terms of your loan. You know, those are things that you can do to see, because everybody's being really understanding that everybody's under a lot of pressure right now. So, I would say that, you know, the thing to do is communicate. Just have that open communication with folks to make sure that they understand where you are and the issues and problems you got going.
Director Goins, we have a question from Susan in Lincoln. She says, if the small business loan program is so good, why have so many people applied for unemployment benefits? Apparently, the small business owners have not kept their employees on the payroll. So I guess more of a statement than a question, but what's your reaction to that?
Well, let me say this. Here in the state of Nebraska, I'll talk about two loans. That's the Payment Protection Loan, which is the PPP, and the Economic Injury Disaster Loan, which is the EIDL loan. Here we have approved over 8,000 loans, totaling about $1.5 billion. We have another 8,000 in the queue that total about $459,000. The challenge right now is we're waiting for word from the Treasury so that we can get funding documents. Once we get the funding documents, then those loans will close and that cash will hit the street to take care of our small businesses. The PPP is designed to keep the employees or the teammates engaged with the business. And that is a loan that is designed for 8 weeks of payroll or less than $10 million. That loan is a loan that is at 1%. It's a 2-year term. It's deferred for 6 months. And that will be a loan that once the cash hits the streets, then it will allow those business owners to bring those employees back and keep them engaged in the business.
And are you already seeing a lot of businesses line up to get this money? Are you?
Oh, absolutely, absolutely. Again, over 8,000 loans have been approved for $1.5 billion.
And if I could just piggyback on that just a little bit, I want to be clear that when Tony's talking about that, it's not the state of Nebraska making those loans. It's not the state of Nebraska taking those applications. Those are small businesses that are working directly with their community banks. So we've got 160 Nebraska banks that are working with those small business owners to be able to process this. Those community bankers are working, you know, early mornings, late nights, around the clock to be able to get this processed. Tony, you had a stat about how many small business loans the Small Business Administration did last year versus how much they've done just in the last week or so.
So normally they do 25,000 loans a year, totaling about $40 billion. To date, they've done 459,000 loans. So
it's in about period of about a week.
Period in about a week. So as ops guys, we know that having to scale and manage that level of capacity, and that's why we've got to communicate, but we've also have to execute patience, which is tough right now.
It is.
And I can empathize with that.
It is. It is.
Very much so.
Well, you're watching a special episode of Speaking of Nebraska with Governor Pete Ricketts, also Nebraska Director of Economic Development Tony Goins, and Dr. James Lawler from the University of Nebraska Medical Center. We're answering the phones to hear your questions about COVID-19 in Nebraska. You can give us a call at 800-675-5446 or 402-472-1212. You can also send us questions on social media. Find us on Facebook and Twitter at NET News Nebraska. A question for Governor Ricketts. Today you expanded the statewide directed health measure to close down beauty salons and massage therapy centers because they can't maintain that 6-foot distance. Amber from Lincoln has a question about the safety of construction sites that are still operating throughout the state.
My name's Amber. I'm from Lincoln, Nebraska. My husband is an electrician who goes to a construction site every day that is not essential and it is not safe. There's no running water to wash their hands. The only hand sanitizer is found in the porta-johns, and that usually runs out every few days. There are more than 10 people there. They're sharing tools, break rooms, restrooms. My husband feels like he cannot do his job while still maintaining 6 feet with his coworkers. He does not want to lose his job, but right now his job is not essential or safe, and he fears conditions at his site are going to expose him to the virus and bring it home to his family. What are you doing to specifically address construction sites right now, especially ones that are not critical infrastructure?
We've had several questions on construction sites.
Sure. So it's important to remember that what we're doing here with the directed health measures is really focusing on those large groups of people that are coming in, and we're really encouraging people to keep that 6-foot distance when they're socializing at work. Again, that's one of our 6 rules for the staying at home. So it's not necessarily about we're not making that determination here in Nebraska whether you're essential or not essential. With regard to what we did with the DHM today is really more around making it more consistent with regard to what places like Lincoln and Omaha were already doing, plus feedback we've been receiving from the industry on that. And again, it's only for a period of 3 weeks here as we're really kind of running up to that peak period we're going to have here in the virus. So it's really about kind of an effort to really kind of standardize what we're doing and really put that final effort into the next 3 weeks here to knock down the virus. What I'd suggest for Amber and her husband is really work with your employer. Talk to them about how you can do more around social distancing. We understand that some jobs you won't be able to keep that 6-foot distance. Construction is an example of that. Utilities workers, again, if you've got 2 utility workers and a cherry picker, they're not going to be able to maintain 6-foot distance, but it's still important that they do their jobs. So that's really what we'd like people to do, is really focus on how they can work with their employers to be able to make sure they're doing what they can do for social distancing. Understand they may not always be able to do that, but then also for Amber's husband, if they're running out of sanitizer, maybe bring some of your own, or contact companies. I know there's companies, for example, Streck Labs is providing to Methodist, Pacha Soap and Hastings is making sanitizer. Our Department of Corrections is making sanitizers. I know there's breweries and distilleries that are making hand sanitizer. There's a lot of companies that are switching over to do that to supply the big need for that. So maybe there's some places you can go source that as the supply chains kind of catch up here as well. But again, I would just encourage Amber's husband to go talk to the employers, see what they can do about social distancing. And really, it's going to be something where every employer should be thinking about, what are these things that I can do to keep my teammates safe while I'm still making sure that I provide the services I'm looking to provide.
Now, you mentioned the directed health measure. Sherry from Gretna asks, is there the potential for easing the restrictions on the most recent directed health measure issues today, such as restricting youth group sports, salons opening? Is there a possibility of doing that earlier than May 31st if the numbers of those affected by COVID-19 peak and fall in late April or early May?
So we will absolutely look at the data. And again, the whole point of this is really trying to get this knocked down as much as possible so that as we go into May, we can start looking at, are there restrictions we can loosen? Specifically around the group sports, one of the things that we had done earlier is cancel the extracurricular activities at schools, because schools are operating without kids. And again, it gets back to kind of these groups of people being together. We're trying to keep that to 10 or less. So what we found, though, was there were other groups that were trying to have sports, like team sports, and use actually, ironically, some of the same fields that the schools weren't using for their extracurricular activities. So this is really, again, about trying to prevent that mixing of large groups of especially kids who tend to transfer that virus and give it to each other. So we'll certainly take a look at it, but also just to maintain that consistency with schools, we'll probably make sure that whatever we do for those team sport kind of activities, we'll try and keep it consistent between what we're talking about for school extracurricular activities versus kind of those club sport extracurricular activities.
And also another question for Governor Ricketts. Many Nebraskans want to know how many people are being tested. We got a call tonight from Kelly in Bennington asking about this. More than 1,000 Nebraskans have been tested for COVID-19 since last Thursday, but looking at the number of tests per 1 million people, Nebraska still lags behind some of the neighboring states. Only Kansas has done fewer tests than 1 million per 1 million residents, while Iowa is slightly ahead. States like Wyoming, Missouri, and the Dakotas are far ahead of us in per capita testing. So what has the state been doing to get more tests, and what more can we do as far as testing is concerned?
Yeah, so we know this is a big issue. It's certainly a big issue for us because I think if you talk to Dr. Lawler, he'll tell you that we need to expand our testing so we have a better idea of what is actually going on with regard to the spread of the virus here in our state. So we've prioritized high-risk groups of people to test first. We're probably doing over 700 tests a day right now. And so we are looking to expand that. Over the last week, I've been on the phone with suppliers who supply the reagents, and those are the chemicals you use to actually run the test in the laboratory, at our public health lab or at UNMC. And so that, as you can imagine, those tests are in high demand. No governor feels like they've got enough tests for the people in their state. Everybody feels like they should have more, and they're all asking the same companies if they can buy more. So we are working with those companies on how we can look at our procedures to expand the testing with our current equipment. Where can we get maybe more equipment? How can we make sure we have enough reagent to be able to supply that equipment and keep doing more tests? So these are all things that we're working on every day to figure out how we can expand it. Abbott Laboratories is working on some additional testing as well. So as they ramp up, that'll be another source for us to be able to go do testing that will be different kind of reagents than what we're currently doing right now. So that'll be helpful because that means there'll be other sources of chemicals that we have to look for, but it won't put the pressure on the current forms that most people are using. So there's a lot we still have to do. We know we have to have more. We're working to try and get the supplies, but so is everybody else in the country. And that's part of the challenge that we have is that these manufacturers just have to ramp up the production, and that does take time to do.
And Dr. Lawler, is that a concern that we're not doing more testing?
Absolutely. We would like to have a significant amount of testing increase to be able to see what is happening at the community level in terms of disease spread. What we know about this disease is the vast majority of people who are infected actually have mild disease. So they have a mild flu-like illness. They have just a mild respiratory infection like the common cold. Some people even have no symptoms at all. And understanding how big that part of the iceberg is under the water that we can't see really makes a huge difference in understanding how well our community mitigation measures are working. It helps us to understand whether our preparations for surge capacity within the medical system, our health system is working, and will be, I think, the key to dialing down some of these more restrictive social distancing and community mitigation measures as we move through the spring into the summer. We're really going to need to be able to have that temperature gauge to be able to tell us what thermostat setting we can get away with, and obviously want to get that as low as we possibly can while keeping community transmission at a low and manageable level.
And along those same lines, Dr. Lawler, Bob writes in and says, we have limited testing currently, but if I'm experiencing symptoms, why would I want the test? Does knowing it's COVID-19 even help with my treatment or recovery?
So certainly if you're ill enough to potentially come into the hospital, then having a COVID-19 test helps us to do your management more appropriately. And to either give some medications that potentially can be helpful and not to give other medications such as antibiotics, which will not treat a viral infection. The other thing that is very important for testing is to understand how we can isolate cases sometimes at home, often at home, because again, people aren't necessarily sick enough that they need to go into the hospital. And then we can do contact tracing of those cases to isolate or to quarantine close contacts. And that's going to be an incredibly important public health intervention that we can do once we get these tests online, more tests and better capacity. That case tracing, the identification of contacts and quarantine of those contacts really will be the mainstay of keeping this disease in check as we move forward. That's what a number of countries, Singapore, Taiwan, Hong Kong, who've been successful in managing their epidemics without having dramatic shutdowns, have been able to do it because they have incredibly good public health infrastructure and they've been able to use widespread testing to do that.
Director of Economic Development, Tony Goins, I want to ask you a question from Randy. He said, I've heard it said that this is more of a hard stop rather than a recession or a depression. I'm interested in what Mr. Goins thinks about this terminology and how he sees us restarting our economy.
Well, I think the restart really centers around, let me answer it this way. I think you have to relook at your business model and determine what you need to do in order to get through these challenges. And I think the first part of it is you need to really think about your debt servicing. So you contact your vendors and you ask your vendors to work with you. I mean, clearly if your revenue is dropped by 80, 90, in some cases 100%, then working with your vendors and making payment arrangements with them, that's a lever to help you get through this crisis. Secondly, I think, as the governor mentioned earlier, you need to contact your banks. The SBA has allowed, if you have an existing SBA loan, you can defer that loan, but the SBA also came out with a program that if you do have an existing SBA loan, the SBA will pay 6 months, and that's principal and interest on that loan. And that's a large lever to help a small business in terms of debt servicing. You also need to contact your landlords. And I know a lot of banks, I talk about Steve Schmidt from Frontier Bank and Gary Steer, who owns a large commercial development. He got deferment for his loan, and he was able to pass that to his tenants. So I think there are a number of things that small businesses can do to help get them through this recession. I don't see it, or this tough time, I don't see it as a hard stop. I see it as a lull, and you just have to work through it.
The Federal Reserve today announced expansive efforts to help companies get more funding. They want to pump $2.3 trillion into the economy through new and expanded programs. So how much is that kind of funding at the national level going to help businesses in Nebraska? And can we fund our way out of an economic downturn?
Well, let me say this. That's a new program. We're still waiting for details, so we don't have all of the details surrounding that $2.3 trillion. That's a program that came from the Fed. The majority of what we're talking about right now it's really coming from the SBA. So we don't have a lot of details about that $2.3 trillion right now.
Governor Ricketts, I want to turn to you. This question comes from someone calling themselves a concerned state worker. He or she says that they work for the state of Nebraska, and despite the ability to do my job remotely, we're told we can only work from home every other day. There are fewer people in the building at one time, but we still have to use common spaces and risk taking some of this home and infecting our families. Why are people with the ability to work remotely still being forced to come into the office as far as state employees are concerned?
Yeah, sure. So we do really important things at the state of Nebraska. We have a lot of really vital functions, and they all need to keep going. And we are working to be able to allow people to work from home. We've gotten in so far, we've ordered a bunch of new laptops, like 250. We should get another 500 next week or so. About 30% of the workforce is working from home right now. We've done extended leave options. We've gotten a variety of things to be able to help out our teammates to make sure they've got that income security. But there are still functions that people have to come in and do. Some functions just have to be done on site. And so we are working with our managers to do that proper social distancing. But similar to what we were talking about the construction sites, it's really about trying to limit those large crowds. You're still may have to come into the office building, but we do want to spread people out where we can. But it's about large groups of people getting together that are the biggest concerns about spreading the virus. What we want to do is make sure our workplaces are as safe as possible. So we're working on increased sanitation, janitorial services, working on social distancing, spreading people out where we can in our office buildings. But we also have to deliver our really important services. It's especially in a time of emergency, it is absolutely vital that the state continue to provide those services to the people in Nebraska, because this is what they looked for us to do. We've got to be here for the people of Nebraska right now to make sure that, for example, if somebody needs to know how to process an SBA loan, they can contact the Department of Economic Development. If somebody needs to get a refund check back from taxes, the Department of Revenue has got to be there. If somebody has to fill out that unemployment insurance form, somebody's got to be there for the Department of Labor. So there's all very, very important things that we perform to be able to do that. And I'd just kind of wrap up by saying to that person, say, hey, go talk to your manager. See what other steps you might be able to take to be able to do more of that social distancing. Maybe there's ways you can move around the office so that people can be spread out more. Maybe we're just waiting for a laptop in so you can spend more time working from home. There may be very good reasons why your manager is only doing it every other day. But again, it gets back to that idea I was talking about a little bit earlier, communication. Go have that conversation.
So we had the situation in Grand Island at the meatpacking plant where several workers tested positive, and so that's the foundation for this question that comes from Gladys from Lexington. Have you developed a multilingual approach to getting information out to non-English speakers in Nebraska to your crisis and emergency response steps? And Ben also adds, what about the impact on the huge number of undocumented workers and families in Nebraska? So a lot of that surfaced. They said some of the workers there, weren't getting the information that they needed. What is your office doing about that?
Yeah, certainly. I think there's a lot of opportunity to do a better job communicating to people whose English is not their first language, and also doing it in a culturally sensitive way that people, that it will help get the message across, thinking about how would I want to communicate this to make it resonate for those communities. And that is absolutely something we're doing at the state of Nebraska. So first of all, we always, our Department of Health and Human Services does a number of things in different languages, but for my website specifically, we are now putting out, our social media in Spanish as well as English to be able to help do that. I've been on the phone, for example, with JBS in Grand Island pretty much every day since Sunday, talking about what they're doing. In fact, they just provided me with the documents they're sending home every day to their people. So what JBS is doing is they've got all their instructions about, the social distancing and, if you're sick, stay home, and everybody in your household stay home. That's all being printed in English, Spanish. It's being printed in Arabic, and I actually had to ask the guy he sent me one of the languages. I'm like, what language is this? And it was Somali. So they are working to be able to communicate with their folks. Dr. Grover, for example, from the Grand Island Public Schools, is also doing communications in multiple languages. Mike Flood with Flood Communications is setting up a bureau in Grand Island in conjunction with News Channel Nebraska and Telemundo to be able to do broadcasts in Spanish to help get it out. St. Francis is paying for advertising in both English and Spanish, again, driving home those key health messages. So there is a lot of work on behalf of not just the state, but a lot of folks are looking to be able to communicate to folks whose English is not their first language, to be able to communicate out what they're doing. I know I was just actually speaking with Teresa Anderson from the Public Health Department in Grand Island today, and some of the really great stuff she is doing around thinking about how to communicate and focusing on, hey, you're protecting your family, and really focusing on the things that are going to resonate with those communities so that it helps get the message across about how important it is to take these social distancing, physical distancing stand measures so that we get that buy-in from people, that they really comply with what we're trying to get them to do with regard to make sure we slow down the spread of the virus.
Dr. Lawler, new CDC recommendations for essential critical workers exposed to COVID-19 today, but those workers are not showing signs. They include take your temperature before you go to work, wear a mask, practice social distancing, go home if you start to feel sick. Is this an effort to start relaxing restrictions at the federal level?
I'm not sure if it's an effort to relax restrictions. I think some of it is driven by necessity. Obviously, we have to have these critical infrastructure workers on the job, particularly the healthcare working force. And so we have to make every effort we can to keep them on the front lines. I think that some of these efforts really are part of the analogy that I've used before, which is the Swiss cheese, right? Every layer of Swiss cheese has a bunch of holes in it, but once you start to layer those on top of each other, those holes don't line up, and eventually it becomes an impermeable surface. And so all of these things, taking your temperature, monitoring yourself for symptoms, those are things that we do at UNMC, particularly in our biocontainment unit when we have staff taking care of patients. And masking is also, I think, a very important component of that. That's more of a protective effort that we do for each other. So I was wearing my mask before we just got on stage here, and that's something that we can all do, again, to protect the folks around us. So masks really probably do the most to protect you and prevent you from disseminating virus if you're ill. And again, many people shed before they're symptomatic or without symptoms at all. And so that social contract, if I'm going to wear a mask to protect you and you wear a mask to protect me, can be very powerful. And that's also important for these healthcare workers. So even if they are ill, taking those additional measures to prevent them from transmitting to others is an important layer of that Swiss cheese.
Governor Sandy from Columbus asks, what will the state do to help farmers faced with low commodity prices for corn and beans?
So that is going to be a challenge for all of our businesses, including our farmers and ranchers who have struggled with low commodity prices. And we're going to work with the USDA with regard to how they see that going forward. And then again, when the legislature is back in session, we're going to continue to focus on things like property taxes and what we'll be able to do for continued property tax relief within the state budget. So, and then generally, we're just looking to be able to continue to focus on the things we have been doing with regard to when things start coming back to normal, focusing on trade and opening up markets overseas so that we can sell more of our products overseas. 95% of the world's consumers lie outside the United States. If we're going to grow our agricultural products, we have to sell them in those markets. So we need to continue to work with the USDA on helping to open up those markets. And then, of course, focusing on value-added agriculture, things like our ethanol plants. Our ethanol industry is really in tough times right now because of low oil prices and just the decreased demand because of people aren't driving right now. So we've got a big challenge right there. And the ethanol industry takes up about 40% of our corn crop here in the state of Nebraska. So that's a very important industry to make sure that we keep that operating. So we're going to be focused on what can we do else with regard to the ethanol industry. But a lot of this is going to take to be able to get past when we got this virus knocked down. So again, this gets back to, Sandy, tell people, stay home. Next 3 weeks, 21 days. Stay home, stay healthy, stay connected. Follow our 6 rules around, work, stay home, shop only one person at a time, help kids, elders, and exercise, in a smart way.
Director Goins, when we see problems on the farm, when the farmers are struggling, talk about how that impacts the job you're trying to do and helping Main Street grow.
Well, agriculture is one of the largest levers of our economy. So, as the governor stated, we work really hard to take care of our farmers and ranchers. And, it's not just farmers and ranchers, it impacts our technology sector also, because technology is a large driver of our agriculture. So, at the end of the day, we have to continue to work through the current challenges that we have right now, continue to focus on technology, continue to look for ways to get us through this crisis and look at what we're going to do to thrive on the other side.
And then just on that too, again, you're talking about other businesses that are important for agriculture. We were talking about Grand Island and JBS. Meat processing is very important for our country. It's part of the food supply chain and how we keep our country fed and indeed the rest of the world. And so we've been working closely with JBS and talking with the Nebraska cattlemen and USDA about what steps can we do to make sure that even if it's at a lower capacity rate, that we keep that meat processing going, because that's going to be important for our ranchers to be able to have a market for their cattle so that they can be processed. So this is all interconnected together, how, again, we have to, keep these key industries that regard to agriculture going, like ethanol, like meat processing, because that's who's going to be consuming things like our corn and our cattle. And ultimately, that's how we keep, the economy going.
Governor Lisa asks, how is the governor's office addressing the issue of COVID-19 as it pertains to those experiencing homelessness in our state? What options for safe shelter are being established throughout the state, similar to those efforts for medical staff?
Yeah, absolutely. So this is one of the things that we're working on with our public health districts with regard to homeless. In fact, I think we mentioned this on the show, one of the last shows we did. But anyway, so actually what we found as we started working with our public health departments, like here in Lancaster County, the public health department already has a plan for what they're doing with regard to helping the homeless. And so we are certainly there to support our local public health departments. But as the case here with Pat Lopez and Lincoln, they've kind of got it under control with regard to what their plan is right now. And as we've talked to other public health directors, they haven't asked for our help at the state yet. So we're here to support our public health directors and the local folks in the communities, and they're the ones that are on the front lines with helping the homeless. And so as they need help, we will step up to be able to do that. I've talked about some of the, like today we talked about the lodging we're providing to healthcare workers and first responders and so forth. So we are prepared to work to do that sort of thing. But so far, the public health districts locally have been handling it, and we're here to support them when they need the help. But so far, they haven't needed it.
As we wind down, we have time for maybe a question or two. This comes from Jim in Norfolk. The unicameral passed the $83 million bill for coronavirus spending, which included $38 million for personal protection equipment. Our local health department has informed our providers that virtually none of their requests for PPE will be fulfilled. As medical professionals, we willingly sign up to fight this pandemic. Without adequate testing, no way to prevent it, and now we are severely limited in our PPE. What can we expect to receive regarding PPE?
Yeah, sure. So obviously we are working to get, just like the testing, every state is trying to get PPE. And so we are working with our suppliers and our vendors to be able to do that. We received 500,000 gloves last week. We got another 97,000 N95 masks on Monday, and we're continuing to work with those vendors to bring in that PPE. We actually, 2 weeks ago, asked all the public health departments to survey the folks in their communities, whether it's hospitals, nursing homes, volunteer fire departments. I mean, you get the idea. Anybody who would, want to use PPE, law enforcement, as to what would their needs be, especially during a peak. So for example, if you wanted to outfit every one of your people in a mask working in a nursing home, for example, how much do you have? What would you need? So we're taking those requests in, and then the state is going out and, as commenting on, looking to go out and buy that in the marketplace to really leverage our buying power to be able to bring that in and supply the entire state. So we are looking to do that. We've distributed out what we've received so far from the Strategic National Stockpile from the federal government. That's all been distributed to our local public health departments. And as we get more in, we will do that as well. We've spent about $275,000 on PPE we've received. So you can see it is a relatively small amount so far, but we are trying to get much, much more.
In about 20 seconds or so, Governor, as we wind down here, what's the outlook? How are we doing as a state?
Well, if you compare us to states like New York, where they had their first case on March 1st and we had it on March 6th, we're obviously doing much better than New York because, A, relative to how much virus they had and how much we did, we took steps earlier. But we can't get complacent. Everybody's got to stay home these next 21 days, really hammer this and get it done.
All right. Thank you very much. That's all the time we have here tonight. Thank you to Governor Pete Ricketts, to Dr. James Lawler, and to Tony Goins for joining us, and to the NET crew working behind the scenes to bring you this program. Governor Ricketts is updating the public on the state's coronavirus response each weekday at 2 p.m. Central. It's going to be 1 p.m. Central Monday due to his radio call-in program, but normally it's 2 p.m. You can watch those news conferences live online at netnebraska.org. You can also listen to those updates live on NET Radio. And you can watch tonight's program online at netnebraska.org/coronavirus. You can also send us your questions for next week's live town hall with Governor Ricketts. That's coming up next week on Speaking of Nebraska. We'll see you then.